Today, I'm so happy to introduce you all to my new guest. His name is John Bjornson, and he's a dentist here in Victoria. I met Dr. Bjornson almost a decade ago when I started my new life here in Canada. And since then, he has been an important and dear part of my life and the life of my family. We love coming to his office, and we are blessed to have someone who is taking well care of our health. So thank you, John, for helping me out this way too. And thank you for accepting my invitation to join Liminal World.
Absolutely, Natasha. I'm more than delighted for you to invite me, and I'm very much looking forward to our conversation this evening.
I needed to come to your office only once to realize how much you love what you do. You put a lot of time and a lot of energy in accommodating your clients' needs and wishes. So I would love to start our video by bringing up some background story. How did you decide to become a dentist? And if you can share a few details about your career path.
Wonderful. It's for myself, it became apparent very, very early in my life that this was going to become the pathway of my career, but not for reasons traditionally that youngsters, I think, are inspired to pick a career path, which might be, either one of their parents, for example, might be, a teacher or an attorney or an engineer or a dentist. My parents were most certainly not dentists, but I was always at the dentist. And the reason for that was my teeth were quite unhealthy growing up. I was, in fact, at the dentist so often when I was small, I didn't even really comprehend that there might be alternative career choices for myself. My dad was an accountant. I didn't really understand what he did. My mother was a nurse, and that kind of connected with the caregiver in me that I think was part of who I was from a very young age. But I realized that if I became a dentist, it would be ideal for me because my house was very close to the dentist office that we attended. And I thought that if I became a dentist, I could live at home with my parents for the rest of my life and, in fact, walk to work. So those were appealing elements of the career decision. And I must say, I don't think I was much older than in kindergarten that I decided that that would be what I was going to grow up to do. Later on, I started to recognize I had a great love and a passion for science, also working with my hands. And, I was very close to my mother growing up. As I mentioned, she was a nurse. So I knew I wanted to do something that would allow me to take care of people. Looking at dentistry, it seemed to afford me that opportunity in conjunction with working with my hands and really aligning myself with a body of information that would appeal to my affinity for science. So I really made up my mind very early and never wavered from it. I went to the University of Victoria for an undergraduate degree in biology and then followed that over to the University of British Columbia in Vancouver for 4 years of dental study. And I was very fortunate to have the opportunity to come back to Victoria, the town that I grew up in, and I began my practice in 1996.
So 24 years ago.
Exactly.
Amazing, amazing. I'm always impressed when I hear people knowing that at that early age what they
Yes.
want to be. It's completely different than my path, and I'm always curious, like, where did I go wrong?
Yeah.
Let's go back to March 2020, when actually, at least here in Victoria, we start taking stories or news about coronavirus more seriously.
Exactly.
And what I've noticed, people remember what they were doing in those 2 first weeks of March, because those days were actually the days when we switched into the another reality. So what were you doing, if you happen to remember? What were you
I
doing in
remember,
that?
yeah, I remember this very well. I think everyone remembers where they were when they became introduced or acquainted with this virus. And for myself, working in the dental field, um, I became informed about the sort of peripherally about what was going on, mainly in the Lower Mainland, Vancouver. Um, I would say probably about the second week of March. Um, every spring in Vancouver, there is a very popular dental meeting called the Pacific Dental Conference. And it was again being hosted by Vancouver. It's a very popular meeting, an excellent array of international speakers, talented presenters. And it just happened to be that this year, my office team and I had decided not to attend. But there were many of my colleagues that were making the trip to Vancouver to attend the conference. I can't say that I was forecasting that this event would have really significant implications as it related to the coronavirus infection. But when I was asked by my colleagues to just be available for their own patients who may have dental emergencies or need urgent care while they were attending the conference in Vancouver, I said, yes, it would be my pleasure to do so. But in the back of my mind, I remember thinking, I wonder if this is such a great idea to be leaving the relative, uh, now I would use the term safety of Vancouver Island and attend this meeting, which had over 10,000 attendees usually participate. So as it turned out, my feelings were valid. It turned out that this conference had not a small number of individuals who were affected by the COVID-19, and as the as the as other people were beginning to become infected by the virus, our provincial health officer, Dr. Henry, and the health minister, Dr. Dix, as well as for myself and my fellow colleagues, our regulatory college, the College of Dental Surgeons and the BC Dental Association were paying very close attention to the activity of the virus in the Lower Mainland. And as the number of cases began, I remember thinking this could most certainly have some effect on my capacity to care, even over here in South Vancouver Island. So I remember the weekend after the conference came and went, and we were gathering in my office, my team and I, and it was a Monday morning, March the 16th, and things were very, very different from the tone of the office that I left on Friday. We were informed by our regulatory college that we were strongly advised by Dr. Bonnie Henry to discontinue not all of our dental care. the vast majority of what I provide to my patients in the guise of dentistry is preventively based. But there are elements of my practice that are focused on addressing emergencies, or what we would call urgent care problems.
Mhm.
But as I say, the majority of it is, you may describe it as elective.
Mhm.
We were advised to close our doors to our patients in preparation for protecting the rise of the curve of the virus, and as a way of limiting the spread. So all of a sudden, our careers were essentially evaporated,
Mhm.
and we did not have any opportunity to forecast how long we were going to be required to have our doors closed to our patients. They're really like everyone else in this circumstance. There was no roadmap. This was such a novel experience, really with no previous history to compare notes with, or determine how we were going to manage ourselves in the midst of it. So we
Well,
closed the office. Go ahead.
no, no,
We closed.
no.
No. We closed the office and we all went home. But that was not the end of my practice or my work, because I was very certain of the fact that we needed to initiate some communication with all of our patients and friends, and advise them of what we were being required to do and what we were available for. Even though our preventive therapies were effectively shut down, I was still everyone's dentist, and I was still available to all of our patients should the requirement for emergency care arise. So we went right to work creating a portal through our website to get in touch with me and to share information on how to access our services, in directing ourselves to provide emergency care for things like acute pain or trauma, or circumstances that were, to the individual experiencing them, very, very serious. So that took place almost immediately after I closed the door.
Mhm.
But we were very, very much working on a day-to-day basis. We were unsure of when our regulatory college, through counsel with Dr. Henry and our health minister, Mr. Dix, would determine when we would be able to return to work. It was very, very uncertain, and I think, like all people, myself as a care provider, does better when circumstances are a little more assured. And my uncertainty of when we were going to be able to reconnect with all of our patients in an era of, we would say, new normality,
Mhm.
was very, very vague for me. So we did our best to be at home, but also be available for easy contact.
Mhm.
And that's where we stood for, as it turns out, almost two and a
Next
half months.
2.5 months. Those 3 months in Victoria, that was the period from mid-March until beginning of June,
Right.
were for many people the longest months ever, and
Absolutely.
the strangest although we have a beautiful spring in Victoria,
Yes.
there was nobody who didn't experience some kind of anxiety or fear, or as you said, you didn't know if you will work, when you will be able to work or continue with your practice. I remember getting emails from you, which I appreciate a lot, especially knowing that if in case of emergency, I can reach you, John. That was very important for me, because my kid lost her first tooth in that 3 months.
That's right. That's right.
I was like, I need to have somebody, I need John to rely on him, at least to ask questions, which I did. And I want to thank you publicly, because I was communicating with you and, in a sense, getting rid of my fear and helping my kid who was having a few normal things, issues, whatever, but normal things. But what I want to ask, what did you do in those 3 months? How did that affect you?
Yeah.
Personally and professionally.
Right. No, I appreciate the question. There's a lot to that. I think everyone will agree that there was a lot of emotion. I didn't meet anyone when we were back to work that didn't have some kind of a story to tell about how this virus affected them. For me personally, I found it, on the one hand, extremely meaningful and special to be at home with my family. My wife and I have a beautiful son who's 8.5 years old. People listening with children will agree. These beginning years are so short, and there's so much change that children experience during the first part of their lives as they're growing. So to be at home with him for days and weeks on, and in this case months on end, was so special and really a great joy and a great gift. So I loved that part of it. I was in the garden every day with my wife, and I literally saw the blooming of spring for the first time in my over 50 years on this planet. I was so connected to watching the garden unfold. And so that connection was something very, very new and very special for me, that I will never forget. Professionally, it was a time of great stress. I was very, very much focused on trying to determine what kind of world I was going to be returning to, and what environment I was going to be practicing in again. It was very much for myself a situation where I was trying to make educated predictions on what kind of equipment I was going to require, what kind of protocols for my office I was going to need to design, all in the interest of my patient's safety, receiving dental care in the era of COVID. Back to trying to determine equipment, etc. We use this word that is everyone's aware of now, I think, called PPE, which stands for personal protective equipment. So trying to source masks and gowns and gloves and all of the traditional equipment that a dental practice makes use of on a regular basis, but as well as some of specialty items that were being required, special suctioning equipment, and then we had elements to maintain the safety of my reception team. We had plexiglass barriers for our reception desks. We had air purifiers for all the treatment rooms and the reception lounge. New sterilization equipment. I could go on and on about just how effortful it was to determine what elements were needed for investment and purchase, and how we were going to implement them. I was constantly in touch with my team, my staff of that are working with me every day at the office, checking in with them, fielding questions for them, addressing some of their own concerns that were very significant and that were impactful in terms of their comfort and abilities to return to work with me. And of course, I was also very gratefully connecting with my patients. And of course, I remember your beautiful little girl, the news of her first tooth being lost, and talking with you about that. But also, I would say every second day, I did get a phone call or a text message or an email from one of my patients concerned about something. Was this condition something that they felt they needed to see me about immediately? Or was this a situation that I might be able to contact a pharmacy to provide them with medication for, just to help them weather the time between now and when they would be able to see me again? So I was very joyful to stay connected to my patients. As you recalled, Natasha, I wanted to let everyone know that I was there and that I was thinking of them, and even very truthfully that I missed them. My practice is for myself one where I feel a great many of my patients are in fact my friends. Um, I love seeing them outside the office at the grocery store. I love feeling proud of the caliber of care that my team and I are providing them. So I wanted to sincerely reach out to everyone and let them know that even though they weren't coming in to visit with us, that I was still there, that I thought of them, that I missed them, and that I was wishing them well through their own COVID experience. So
I'm sure, John, that they
yeah,
appreciate it, because I remember feeling the same and knowing. I even remember telling my husband, we are now in touch with John. If anything comes our way, we are safe. So I remember the feeling, and I appreciate a lot. And I know that people really are grateful for those like small things, but in that circumstances, that means a lot, means a lot.
I'm really so happy that that resonated with you and your family. Um, I received back a great many wonderful notes of appreciation and encouragement to me, and that was exceptionally meaningful and special. So it was, when you asked me how I was, personally and professionally through that time, it was such a mix of emotion. But in the end, I think I'm one of those people that is a bit of an incurable optimist, and I worked very earnestly to accentuate all the positives and count the blessings and to lean into all of the wonderful things that I think COVID actually brought to me, as opposed to what it took away.
When you were
Yeah.
talking now about the isolation and how you didn't practice, but you were predicting and staying in touch with your crew and figuring out what are the new materials that you need, and how you were investing again time and energy and money into preparation. I felt like, oh, he's talking about actually preparing for a new exam, because it looks that way. Suddenly you have to pass one more test. You were not aware of that. It's a sudden task. It's a pretty intense, and your career depends on that, your life, but you are ready. Once you were talking, I was like, he was ready. He was doing everything which is behind the scene. But once you reopened June 1st, that helped you a lot to manage the office, because June 1st was a huge test. You came back, you have to manage your office, you have to keep together your crew, you have to open the door and welcome your clients. Some of them are coming very upset or worried. You need to put new protocols in place. You have to regulate yourself, which is a hell of a lot of responsibilities, new responsibilities, which is like a new scary exam.
Right.
So, John, what was your way of coping with that enormous pressure?
Right. Well, I will say that as a dentist, traditionally I'm used to working with stress. I meet a great many number of people that bring anxiety to their appointments, and over the course of my career, I feel I've been able to develop not only just the technical skills to provide people comfort under the guise of that, but also just develop the humanity to be empathetic and to understand what it's like to be stressed and to be receiving dental care. We also, as dental professionals, all through our careers and going all the way back to our training, we learn to work in an environment where there are great numbers of bacteria and viruses and things that can affect our own health on the way to providing treatment to our patients. So in terms of being able to contend with the stress, I don't want to try to express to you that I am superhuman. I am most certainly not, and I feel anxiety like everyone else does. But I just feel that in terms of my preparedness, which I'd spent a significant amount of hours, days really, getting ready to reopen the office. I had an incredible amount of confidence, and with that, just the shared collaboration and the confidence of my staff, my team around me. I feel like we were able to reopen our doors feeling very certain of our competency to provide very, very high standards of care under the guise of new regulations. With that said, the first week back was challenging. As I said to my teammates, I felt like we were an orchestra that had been disbanded for 2.5 months, and we really had to learn to play together again. So as soon as we started, playing our pieces of the music, I started to recognize that this tune's very familiar. And we even had, some applause from our patients as our audience. So it was really all about preparation and confidence in our abilities as individuals, but also collaboratively as a team, that allowed us to come back and contend with the stresses of reopening and the stresses of initiating our care delivery systems during the first few weeks of the restart in June.
That's actually, John, the definition of resilience. Like those, I remember reading one article where a doctor mentioned that actually resilience is about 5 C's. You need character, you need confidence, competence,
Right.
cooperation, and contribution. And you
Beautiful.
got all. You got it all.
Oh.
You got it all. And I was in your office maybe 3rd or 4th week after you reopened.
That's right.
And I
That's
didn't
right.
notice any, except getting messages about when I'm supposed to enter the office. Everything else was as usual. I didn't feel any tension. All the smiling faces were there. The procedure was like impeccable. I was with my kid. She didn't notice. She didn't know that Corona is out there.
Right.
So everything was very smooth and oof. So you passed the test. That's the definition of resilience. You actually show that's the phenomenal example of resilience.
Thank you. I so appreciate, that compliment. That means everything to me. And, as a healthcare team, we can all feel like we are prepared for something, and that we are able to execute the requirements for, expert care and a wonderful outcome. But really, as caregivers, we are really nothing except for the person that is in our office, in this case, in our chair, receiving the treatment. So for us to have that kind of a compliment and an accolade as it relates to the delivery of our treatment, that just means the world to me and to my staff as well. So I'm really grateful for that. Thank you, Natasha.
What did you do, John, with all the appointments that happened in those 3 months when you were not working? What happened with those appointments with the people? Did they contact you? How did you manage all those missing appointments?
Right. Well, we realized, within the first day, that there were a great many of our patients that were going to have their appointments rescheduled. Because as a practice that is very dedicated to preventive therapies, almost all of our patients have pre-appointed with us for their regular maintenance care. So when we had to close the office, I did a quick math calculation, and I realized it was going to be many hundreds of our patients that were going to have to potentially be reappointed. So as the weeks unfolded, we would have to advise our patients who were scheduled to come back into the practice that we were going to have to cancel their appointment. I wasn't sure at that time what the system would look like as it related to rescheduling them. But as soon as we were able to come back in the first week of June, it became a very high priority on the part of my administrative staff to contact our patients who had had their appointment canceled and endeavor to provide them with a new appointment. This was a very time-consuming effort, and it also required that I hire some additional team members. We had to hire 3 new dental hygienists that were going to be able to participate with us on a part-time basis to provide the additional hours of care that were required to fulfill the rescheduling endeavor. So it was just a lot of time and a lot of personal attention to communicating with our patients and offering them a makeup appointment.
Mm-hmm.
Many of them accepted that with great appreciation. There were some patients who thought that they would probably be all right if they would just accept being scheduled into the next time slot, whether that would be within the following 6 months or 9 months, or 3 months, depending on their individual treatment needs. But I want to shine a bright light on the efforts of my administrative team. They were really wonderful in reaching out to people, and as well provide a compliment and a great debt of gratitude to all of our patients that understood very sensitively what the tasks were for us,
Mm-hmm.
in terms of providing them with makeup appointments. Everyone was so understanding and supportive, and so we couldn't have done it without everyone understanding what we were trying to effectively create, which were many hundreds of follow-up appointments, over 500 to be precise. So it took a lot of time and a lot of energy, but we were able to contact virtually everyone. I was very proud of that fact.
What about your team? Did you have any changes in your team members? You said you had to hire 3 new part-timers, but what about
Yes,
the rest of the crew?
exactly. Everyone was willing to come back to work. And again, I think it really speaks to the level of professionalism on the part of these women, who are really just true professionals in the highest sense of that title. They came with confidence and certainty that we had everything worked out. Um, and I will be forever appreciative and indebted to them for really just coming back with a sense of of true teamwork guiding their commitments. So it was my original staff that when we closed the practice came back when we opened the practice, and it really was just very special and very emotional for me when they all shared with me their certainty that we were going to be able to return to work as a full operation, and where everyone was there committed to supporting each other and the patients that were returning through our front door.
As a client or as a patient who is coming from this side, I can
Right?
tell you that I can sense that every time when I'm in your office, I can sense the good vibes.
I'm so glad. It's something that we genuinely convey to people each day that we come to work, and it always is so special and meaningful when it's sensed and appreciated by our clients.
I would love to send a message out there, because this is a great story of resilience, commitment, community, like contribution. And I would love to ask you what actually this experience taught you about yourself, or about your job, about people. Like, how do you see this change? Is it for any good? There is a lot of bad things and we know them, but was it for some good?
Yeah. You know, I've had a lot of time to contemplate that. And I will say, I think what I've taken away from this whole experience is a reaffirmation for myself of really what the most important things in life are. And for me, that begins first with health, um, with with our capacity for ourselves to be healthy and to have opportunities to um, access systems that provide us with treatment for problems that we have, be they medical or dental or otherwise. Um, Health has really, I think, had such an intimate focus placed upon it during this time, when you consider people who have been very vulnerable um, to this virus because of underlying medical conditions. Um, just, our ability to be healthy in our emotions and mentally, um, in our minds. So that has been something that has been very much for me highlighted, and the importance of 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 well-being, of self-care and access to care. Um, Very closely to that, though, is the importance of community and connection in our communities. That begins first with my wife and my son, my immediate family, as well as to close friends, and neighbors in my community, um, but also just our communities at large. As humans, we're very much um, communal beings.
Yes.
Um, I think the isolation of this event has affected people very gravely in some circumstances. And I think as humans, our abilities to reach out to people and to feel others reaching out to us has maybe not been examined um, as greatly as this um, pandemic has forced us to examine it now. So I've learned that um, being able to connect and maintain connections with people um, is very much important to our state of well-being. Um, and I think just thirdly, our abilities to um, just realize that we need a lot less than maybe some of the other luxuries in our lives would have us believe. Um, we are really equipped with all basic necessities to get through a period of great uncertainty and discomfort and loss like this pandemic has um, pushed us into. I think realizing moving on from here that we can just lean each other for support, and realize that even we are all limited, we're not limited as much as we feel we are, that we do have a reason in ourselves to push forward during times like this, and look for the light when we can't see it, and maybe also try to be that light.
I'm also hoping that we will come out of this experience stronger, more connected with the stronger vision of interconnectedness, and like not just connected with ourselves, but with nature as well, and other human beings elsewhere. Thank you, John. Thank you for this conversation. I enjoyed a lot. This is the first one that I'm doing during the nighttime. So first time. So thank you for being my guest, and I wish you all the best with your work.
Natasha, thank you. I'm really grateful to you for this opportunity to meet with you, and I extend all of those wonderful wishes to you and your family as well.